Okay, so the musculoskeletal, assessment of a newborn baby. So when they're first born, you want to, you lay them out on the warmer like this, and you basically just do inspection. Mostly, you want to look at the skeleton of the baby. You want to look at mostly the arms, the legs. You want to do a lot of movement, move the arms. You want to move the legs. You want to count the digits, make sure there's 10 fingers, 10 toes, two arms, two legs. That seems kind of basic, but and you want to move all the joints. And you want to make sure again that there's symmetry, that both arms and both legs are the same lengths, and that there's the same amount of joints in them, that both arms have wrists and elbows and shoulder joints, and the same for the legs. And then you turn the baby over and you look at the spine. So we always hold the baby like this and we trace down the spine and the vertebrae. And then you look at the sacrum, and you want to make sure that there are no dimples, and that when you lay the baby down like this, you want to make sure that the creases are equal. I don't know if you can really see this. I don't know. But that the creases are all equal. And also you want to look, sometimes, very often actually, there's a dimple here and that it means nothing, but sometimes we can't really see, but there's actually an entrance. Sometimes there's even a little tuft of hair, and a lot of times they'll do an ultrasound because sometimes that is indicative of spina bifida or some kind of neural tube defect. And then you also want to look at the way the feet are pointing. Sometimes the feet will be pointing in, kind of like this actually, and that's just the way that the baby lay in utero. And then as the baby develops and it gets out of the womb and in that position, it will relax. Sometimes it won't. But you also want to kind of take the baby and maneuver and kind of palpate and maneuver the hips, and maneuver it up, Bartow's maneuver, I think they call it. But you want to maneuver it to hear if you hear any clicks, to see if there's any kind of hip dysplasia, to hear if it clicks outside of the joint, because then you'll call, and the doctor will call an ortho consultation. So you should not hear any of that. And then the last thing is, when you have a baby who is quite large, macrosomia, you also want to look at the shoulders for any kind of shoulder dystocia, if there's any kind of dislocation. Sometimes they'll pull the baby out, and you'll have that.